Hi guys, welcome to my YouTube channel. I am Aranas, a postgraduate medical intern. I basically provide informative videos to medical students. And also I would like to provide aspiring Filipino physicians an idea of what a med student usually tackle in med school. If you find these videos helpful, please don't forget to hit the like button and subscribe to my YouTube channel and click the notification bell. For today, I'll be discussing the clinicopathologic correlation of pyelonephritis. Okay, acute pyelonephritis is an inflammation of the kidneys from a bacterial infection. This is caused by an ascending infection from the bladder. And this is also one of the most common outpatient department case. I would like to shout out to Khristine Caye Fernandez for helping me out in creating this CPC. We'll be discussing each of these sections one by one. Let's start. So here are the risk factors that we have to consider in patients with acute pyelonephritis. The age, from the very young and elderly patient. And the very young is predisposed to having it because according to recent studies, UTI is the most common cause of fever among the young patients. And as for the elderly patients, their bladder could have uh, more reflux from the aging of their body. Next is poor hygiene. The females are more predisposed because the urethra is in closer proximity to the anus. Okay, so it is more likely that they could acquire infection from poor hygiene. And a best advice for our female patients is to wipe from front to back. And as for sexually active female, they are also in increased likelihood in acquiring infection. And also recent urinary instrumentation like insertion of a Foley catheter, urinary tract obstruction, urinary stasis, diabetes mellitus, and a decreased water intake. All of these are risk factors that would increase the likelihood of contamination of the lower urinary tract, which would then lead to lower urinary tract infection. This would now lead to the colonization of the bacteria, and the most common bacteria linked to UTI is E. coli. Okay? And it would colonize the urethra and the bladder. This would now create two results, the inflammatory response and also the immune evasion of the bacteria. As for the inflammatory response, the bacteria would trigger the release of pro-inflammatory mediators and the release of interleukins like interleukin 1, interleukin 6, and tumor necrosis factor. And also, it would lead to an increase in the neutrophils in the epithelium. This would be manifested by the patient as fever and dysuria or painful urination. Now, the virulence factors present in the bacteria would now lead to immune evasion. They would be able to hide from our immune system. So now, they would be able to proliferate, and that would first occur in the bladder, which would manifest as inflammation causing cystitis. From there would be an increase in proliferation, uh, allowing now ascending infection to occur. This may be due to vesicoureteral reflux and the introduction of bacteria into the ureter. So that would lead to the inflammation causing the uteritis. Okay? urethritis. And this would now ultimately lead to pyelonephritis, or the inflammation of the kidneys from bacterial infection. As you can see, starts from the lower urinary tract infections as it ascends to the bladder, ureter, and finally into the kidneys. Pyelonephritis would be causing for responses from our body, the activation of an immune response, distension of the renal capsule, access to systemic circulation, and a decrease in erythropoietin production. We'll be discussing this one by one. The activation of the immune response, there would be a pyrogen release, and prostaglandin E2 would also be released, and that would now lead to an elevation of the body temperature. And our body would compensate by peripheral vasoconstriction and heat loss through the skin. So this would be manifested as fever, chills, malaise, and nausea and vomiting. Next, as for the distension of the renal capsule, this would now cause the flank pain or the costovertebral angle tenderness in patients with acute pyelonephritis. And as the bacteria proliferates even more, it would now be able to access the systemic circulation through the renal vein. That would lead to bacteremia, which would ultimately lead to sepsis. As for the decrease in erythropoietin production, there would be a decrease in the stimulation of bone marrow. Therefore, the erythropoiesis would also be decreased, and it would ultimately lead to decreased RBC production, manifested in our patient as anemia. So, I would like to cite my reference, the 20th edition, Harrison Principles of Internal Medicine. I would like to end this presentation by leaving you this message. You are making your own masterpiece, and that is yourself. Be patient, compassionate, and respectful to your own journey. Thank you for listening and have a good day.